This is an introduction to Anova by Professor Charles Dorner. What does Anova, analysis of variance, entail specifically? To test for statistical significance between the means of 3 or more groups, analysis of variance, Anova, is employed. This method is conceptually similar to running numerous t-tests. Provides a check on the presumption that their values are comparable. To what extent groups differ in mean is not revealed by the Anova statistical test. Post hoc analyses are used for this purpose. The statistical technique known as analysis of variance, Anova, separates the overall variability in a dataset into systematic and random components. The supplied dataset is statistically affected by the systematic factors, but not by the random factors. The analysis of variance, Anova, test is used by analysts to ascertain the impact of independent factors on the regression study's dependent variable. Using a one-way Anova, you are able to determine how a single factor influences the behavior of a dependent variable. For instance, we would be interested in finding out whether 3 different approaches to the preparation process give significantly different results for the median of the exam. To assess whether or not there is a difference in the mean exam results that is significant from a statistical perspective, we can perform an analysis of variance with one way of data collection. A two-way Anova is used to examine how 2 factors affect a response variable, as well as to determine whether or not these 2 factors interact with the response variable in any way. For instance, we could be interested in learning how the different degrees of exercise and gender affect the typical amount of weight reduction. In order to find out, we would perform a two-way analysis of variance. There is also the possibility of conducting a 3-way Anova, a 4-way Anova, or even more than that. However, these types of Anovas are not used as frequently, and the findings of Anovas with more than 2 components might be difficult to comprehend. Here is a real-world example of where an Anova can be used. A manufacturer of sheet metal on a massive scale is interested in determining which of 3 machines produces the greatest output. 10 distinct manufacturing lines begin production at the beginning of the month, and towards the end of the month, the output is assessed. Researchers can establish whether or not there is a statistically significant difference in the mean yield that arises from using these 3 pieces of equipment by carrying out a one-way analysis of variance, Anova, and designating machinery manufacturer as the factor and yield as the answer. If the total p-value of the Anova is lower than our selected significance level, which is commonly chosen to be 0.10, 0.05, or 0.01, then we are able to draw the conclusion that there is a statistically significant difference in the mean yield between the 3 different pieces of machinery. After that, we will be able to discover exactly which pieces of equipment contributed to the highest mean yield by doing post hoc testing. Researchers in the field of medicine are interested in evaluating whether or not 4 separate medications enable patients to experience significantly different levels of mean anxiety reduction. Medical research, they do this by randomly assigning 20 patients to use each medicine for 1 month. After that, they evaluate the patient's levels of anxiety both before and after they began using the medication in order to determine which medication results in the greatest reduction in average anxiety levels. They do this so that they can choose the medication that results in the greatest reduction in average anxiety levels. When doing a one-way Anova, researchers should select kind of drug as the factor and anxiety decrease as the response. They will be able to assess, as a result of this, whether or not there is a difference that can be considered statistically significant in the typical amount of anxiety reduction that can be attributed to the usage of these medications. If the p-value for the Anova as a whole is lower than the criterion of significance that we have set, then we will be able to draw the conclusion that there is a statistically significant difference in the amount of anxiety that is reduced by the various drugs. This would be the case if the p-value for the Anova as a whole was lower than the criterion of significance that we had set. After that, we will be able to do post hoc testing in order to determine exactly which medicines led to the drastically varied findings.